It so anyway, there's some hype, there's some frothiness. I think though they are real. Like so AI scribes have been the fastest adopted technology in the history of healthcare, period.
This episode of Founder Mode is brought to you by Pretty Good AI. Pretty Good AI is the voice-first clinic intelligence platform built for real medical practices. It learns from your exact call flows, from real recordings, then runs your front office 24/7 with zero disruption. It handles scheduling, refills, referrals, insurance, FAQs, and routing while updating the EMR in real time. Practices using Pretty Good AI cut call volume by more than 50% within 30 days. Eliminate hold times and convert more after-hours appointments. No scripts, no workflow rewrites, just an AI layer that operates like your best staff and scales across every location. Pretty Good AI, the voice-first clinic intelligence platform for healthcare that works in production today. Learn more at prettygoodai.co. That's prettygoodai.co.
Welcome back to Founder Mode,
where we talk to the people translating big ideas into everyday breakthroughs.
I'm Kevin Henriksen.
And I'm Jason Shafton.
Today's episode's about AI, health, and how those two forces are increasingly coming together.
From smart diagnostics to daily wellness tools, our guest is tracking the real trends in healthcare AI and where they actually show up in people's lives. Before we get into it with today's guest, Kevin, you're building AI for healthcare right now. I'm seeing the hat right there and our sponsor for the show today. Talk a little bit about what you're building and what you've learned so far.
Yeah, after building a bunch of SaaS tools for more than 2 decades in the Valley, had a couple health challenges in my personal life. My wife had breast cancer a couple times, and my dad died of diabetes and a bunch of complications. And that, combined with my co-founder JJ's experience of having parents as doctors, really started to see how behind healthcare was as we got more involved with it as we got older, and our loved ones did. And when everything's talking about AI, and we're going to talk a ton about that today, and it was, man, all these people are doing AI, but it's how do we play in that space? And wanted to pick something. We've all used ChatGPT. We talk about it a bunch on these shows, and it's pretty good. You start typing stuff in, it gives a decent answer. You add some context, it gets a little better. But the real magic after that third or fourth shot, it feels like it's got enough intelligence to be, damn, that was a great response. And with voice AI, it's hard. You don't get 3 shots. You've got to build that intelligence up front to be able to have that first rip in 400 or 500 milliseconds be correct. And we said, hey, let's go build voice AI. And then where can we deploy that where we'll have the most impact in healthcare? And it's the front desk. People calling the front desk, trying to schedule an appointment, do the medication refills, do whatever they do. Other providers calling to talk to providers. And that experience today is excruciatingly painful. Long hold times, IVRs, all that. And then once we learned that once you are able to take all those calls and you've built that intelligence can then be used to solve all these other complex problems inside the practice. Workflows around insurance, around prior auth, around billing, around moving referrals through the system, getting medical records from other providers, all these things. And so we've really had a fun time starting with this idea of, hey, voice is hard. It's cool to do that in AI, all the way to now we're really transforming some of these practices that we're working with. Yeah, that's the elevator pitch. It's been super fun. Jason, you co-founded a healthcare tech startup before AI changed everything again. And you also have worked in health and wellness for a bit. Tell me what's different now. And what was it like creating a health tech company that wasn't all about AI?
Yeah, over a decade ago, I co-founded a doctor house call app when Uber for everything was hot, when the Instacart guys were in the same co-working space with us in LA. And it was all about how we could use mobile to get better healthcare. And pre-AI, it was, can I order a doctor to my house the same way I can order a cheeseburger or my groceries or a car? And the answer was yes, but it's expensive. And we were trying to do it for a very aggressive price. Our first version of the app was $99 for a house call on the west side of LA, which is insane. That was really interesting and fun. And I think a lot about how that business would be different if it was started today, because there's so much more that you can do with the tech. It was funny. Our first version of the app literally had, you could see the car where the doctor was and on their way to you. That's completely unnecessary information. There's got to be something better we could show. But in those days, it was like, let's Uber. And so you show the car. But I think the things that have stayed the same is that everybody's trying to maximize for better patient outcomes, more time with patients, more provider time, and less admin work. And what is it? History doesn't repeat, but it rhymes. It's the same stuff. The AI revolution is transforming how doctors can spend more time being doctors and less time on taking notes and these AI scribes, right? And how can folks spend less time on the phone with patients doing scheduling and refills and all that stuff? And so I think it's a really exciting time to be building something in healthcare because the tech has finally gotten good. You said several episodes ago, things that used to be easy are no longer worth doing. Things that used to be hard are now easy, and things that are impossible are now hard. And I think that's a good way to look at AI and healthcare tech because we can now do things that were impossible in the tech with the tech that we have. And it's pretty exciting. And I'm hoping that we'll get into it with Max, where we talk about what does that AI doctor look like. I'm really excited about today's interview. I think it's going to be a good conversation. I feel like we should probably bring him out soon.
Yeah, Max isn't observing from the sidelines. He's in the rooms where health and AI are really getting built.
Yeah, his newsletter is Healthcare AI Guy, and over 10,000 executives, doctors, and builders go and they read that and they get smarter fast.
Yeah. Max spent years working for the largest healthcare company in the world, doing deals and partnerships and really pushing new ideas through the system.
Now he's the editor of Healthcare AI Guy and one of the clearest voices on what AI means for the future of health. Should we bring him out?
Let's get into it. Max, welcome to Founder Mode. You've been inside the world of healthcare, M&A, AI, and now you're really translating it all into insights that actually stick. We're excited to get into AI and how it's transforming health and really where it's headed next.
Yeah, excited to be here. Thanks for having me, Kevin and Jason.
Yeah, Max.
My pleasure.
Super exciting. Kevin and I are talking a lot about AI and healthcare these days. So this is a very timely conversation. You've moved through healthcare deals and innovation, and now you're behind maybe one of the most followed newsletters in health AI. What led you to start Healthcare AI Guy, and how has it evolved since you started it in 2023?
Yeah, there's a couple things. In college, I had a good friend who had a popular Twitter account, and I saw all the value that he got from that, frankly, just like constantly posting and getting distribution. I think in this new era as a founder or as someone who's in founder mode or thinking about it at some point, distribution is really key. You see this today, it's maybe not a great comp, but like the Nelk boys with their Happy Dad seltzer or the Kardashians with their makeup line. As soon as you have distribution, rolling out a product or starting a company becomes a little bit easier. So I've had this mindset, hey, I'm interested in this space. I always see myself as a research analyst. Being in that M&A role, you need to be a research analyst. So why don't I take my musings and interests and just turn that into some content, which of course is infinitely distributable through the web these days. So that was the thought I had. And then some of the origin stories comes from, originally I was working at UnitedHealth Group and their M&A team, and they do a bunch of deals, of course. It's the biggest healthcare company in the world. I deploy around 10 billion a year with the small team. So I, aside from the deal work, had another side task was I was on the news team. Every morning I had to scan the news, what our competitors are doing, what transactions happen in the space. And I would write these summary emails to all our execs, like Stephen Hemsley and whoever was CEO at the time. So I was always in the flow of information. And then I got pulled into the business. I moved to Optum Financial, which is the fintech there, and ran growth and partnerships for a couple of years. But through that, moved to the Bay Area. This was like dawn of GPT. I was obviously very AI pilled, still am. And there weren't really any outlets talking about AI in healthcare specifically, even though Bill Gates, Jeffrey Hinton, you name it, would always point to medicine as the first use case. So I just started this anonymous account pretty much to think, okay, wait, I'm super interested in this. There's a void here and I want to build distribution. And then since then, it's just grown a bunch. Obviously, timing is important as AI has grown a bunch in these industries. And then being consistent. And I think the way it's grown is first it started or changed rather in this time is first it started as a anonymous Twitter account, but now we have a popular newsletter that goes out weekly, a LinkedIn. We host events. I'm here in Philly actually this week. We're the first medical school in the US, was founded in 1765 here at Penn to host an event all about AI and healthcare. It's grown into more of a community, a little bit of like a place where people can come, connect, learn about what's happening. And yeah, I'm just basically sharing my learnings and data as I go.
Kevin, I
So-
don't know if you heard that, but distribution is the big thing for founders now. It's not
Yeah.
just building great products.
But it's crazy that it is novel to a lot of people still that this distribution thing is this undiscovered thing where it's, man, the old days of marketing and reaching out and just getting awareness is completely flipped on its head. And yeah, many of the reasons why I started the whole founder mode thing and then Jason and I started this podcast was just like, man, it is incredible benefits of having your own sort of distribution, your own voice, and then just being able to control that. So what sort of experience in the M&A part, you talked about the newsletter. I didn't know that like you had written the internal newsletter, which now makes a ton of sense why that worked so well. But what about specifically in some of the M&A and partnership stuff that you did where, quite frankly, just being aware of what's going on and what's seeing around that corner helped inform how you could be better at your job?
Yeah, I think like during my time doing M&A and doing partnerships, AI was definitely not where it is today in healthcare. A lot of the deals we were doing were care delivery assets. So like your typical provider group, if you will, maybe a couple tech deals sprinkled in there, but definitely nothing that we're seeing today, like these startups that are getting funded and the problems that they're solving. So it was a little bit before, obviously, this current wave. However, I think just doing M&A, being in that seat, you're basically super detailed on the numbers, on the strategy, even just like design and aesthetics. I know that is maybe underappreciated sometimes, but I put a lot of that into my newsletters and my tweets. Is the classic line in banking: if your MD had a packet and like a period was in the wrong spot, he wouldn't even read it. So I've been also trained in this constant clean briefs, easy to digest, these one-pagers, because people are busy, execs are busy. They want the boilerplate download on what's going on. So I think like that cautious and careful eye has guided me through just trying to synthesize content, because on Twitter too, you have 280 characters or less. So you're trying to make a big point in little space. So it's been very helpful for me just thinking through these things, like what moves markets, what matters, where the growth is, what decision makers care about. So all of that has definitely impacted me in this new side quest of media that I've been on.
So good.
Max, it's music to my ears when you're talking about perfect formatting, because Kevin and I are always like, yeah, you can do the formatting stuff. I don't want to do that. You're the cleanup guy. And it's great. It does matter. It matters a lot. So you've written about some pretty wild advances, Max. AI scribes saving minutes per patient, AI agents outperforming doctors. What do you see as the most exciting trend in healthcare AI in 2025?
Yeah, and there's a lot of the obvious ones, like helping providers with their burnout issues and making them more productive, which you're seeing in the scribe market. In general, like the front and back office automation tools, just making, which is traditionally a very low margin business, healthcare, a little bit more sustainable, a little bit profitable, a little bit quicker, more efficient. The amount of paperwork and facts and old technology that's still in healthcare is mind blowing. Like you hear this fact that out of the $7 that are billed by a physician, one of those dollars is spent to go collect that $7. So there's a lot of basically old legacy systems that need a little bit of upgrading. So of course I geek out on the business stuff, but to give you a little bit of a different answer, what really interests me, frankly, is the ability for consumers and patients to get more insight and ownership over their health. Obviously, ChatGPT isn't a health tool. I know they're working on their own health app outside of ChatGPT, separate conversation. But I think the ability to use like LLMs to prompt your diagnosis, figure out a little bit more about what this means. I just got my superpower results actually yesterday, if you're familiar with that company.
Yeah.
And through that, right in ChatGPT, had it describe a little bit, at least to understand what some of these things mean. I think just consumers and patients engaging a little bit more into their health is like super exciting, which is obviously opened up by some of these AI tools, and has also allowed some of these companies like Function Health, which is basically a holistic health company that takes your labs and puts your scores into a dashboard type of format, which Superpower is as well, allowing those companies to proliferate and grow and give people ownership over their health. And a really interesting idea there too, which I've heard Jensen Huang talk about 2 weeks ago on a podcast, is when these companies have all this data, you can basically spin up a digital twin of what you are using all your biomarkers and your DNA metrics, and basically forecast and simulate your digital twin throughout life many times. So you can flag health risks earlier and report them back. So there's so much cool things going on here in this more almost futuristic seeming healthcare world that is enabled by AI, in addition to, of course, these blocking and tackling benefits, which is the business efficiencies, maybe a better diagnosis. A great tool, to name another one that has had a lot of success. Now they're valued at $6 billion with 50 employees. It's called Open Evidence. It's essentially ChatGPT for doctors. A quick anecdote, my girlfriend, she's a PA in her 20s. She uses it. My mom, she's a physician in her 60s. She uses it. So it's also crossed and actively. So it's crossed
Earning
also
that
like the,
$6 million valuation, right?
yeah, it's crossed the age barrier too. You always hear that line that old folks are a little bit slower to use their phones or tech, but no, my mom is prompting AI daily, even in her role. So it's been great to see basically this information and access proliferate a little.
Very cool. I like it. I think, and as we think about the sort of hype versus what's actually happening, what falls on which side of it? And I think to your point, like you've written about so many different aspects of this. What is the one that sort of triggers you the most in terms of on the hype side? And then similar, where are you seeing, wow, this is really transformed? I think the open evidence is a good example, but how about on the hype side?
It's like a riff on it though, right? Because all the AI companies are raising at crazy multiples, but basically nothing else is getting funded. So it's a little bit different than the ZERP era in a way.
Yeah, for sure. So anyway, there's some hype, there's some frothiness. I think though, they are real. Like, so AI scribes have been the fastest adopted technology in the history of healthcare, period. Health systems and healthcare in general have really long sales cycles. Those have basically been cut in half in AI. McKinsey just put out a report last week, the State of AI 2025. Healthcare is like third or fourth in terms of agentic adoption and general AI adoption. And before that, Menlo Ventures put out a report a couple of weeks ago that healthcare is well above average, the industry average across all industries in terms of adoption. Health systems are leading the pack there because they have these real problems with provider burnout. So you see the scribes getting adopted, RCM collecting that dollar I spoke about earlier. They're doing real things. Like, it's not just hype, like maybe the valuations and some of that causes folks to go to that thought, but there's real stuff happening in a lot of transformative companies too. As we've just described, a bridge has been growing a lot. Ambience Healthcare, Nabla. See, those are some of the latest.
Other people like a bridge that sort of get the epic infusion. Do you think Julie will do that again? I mean, everybody's, a bridge got this sort of epic partnership at a point and it's catapulted itself to a new level. Do you think that was a one-off and man, people learn their lesson and that won't happen again, or that could be a sign of things to come?
Good question. I actually think maybe no longer. Epic literally ended that program, I think 2 weeks ago. So there you go. I don't even need to guess. It was already decided, but yeah, it's a real risk. Then again, like Epic is a great company, obviously really strong position in the market, isn't necessarily known for beautiful UI, UX, building that innovative of product. So that allows companies that allows obviously companies like a Bridge and whatnot to really like have a foothold here and help beautify healthcare a little bit, bring like some modern tech into it.
Like the UI.
Yeah.
I like it.
Yeah. There's probably some benefits too from some of these legacy players to partner and do it in a smart way. But yeah, the abridged thing, I don't know if Epic's regretting that or not, frankly, since they're rolling out some of their own scribing tools and stuff now. Hard to say, but I think that might slow it down, to be honest.
So I think it was a good segue to the consumerization of healthcare and also longevity. I think you hosted a dinner in LA recently, and maybe Brian Johnson was there, and you talked about sleep being the best drug. Any protocols or habits from that conversation that stuck with you that you're like, yeah, I'm doing this now, and I think this is it? Speaking of hype versus like really transformational stuff.
Yeah, did have a dinner in Los Angeles. Again, part of this healthcare AI guy movement or community as we've started to host events and just bring folks together. So we had a founder dinner in Los Angeles this summer, and Brian Johnson was there. This is before his mushroom trip, which we're all reading about on Twitter. Live
it was
streaming
exactly 4.73 milligrams, not
yes, and before his $70 million or $60 million raise.
We raised the round for
you got the raise locked in first though.
Yeah. But we talked about Blueprint a little bit. Like they also have some AI that they're going to weave into it. Anyway, I think Brian talked about a couple things like hyperbolic chambers and stuff. Not super accessible, right? But I think the biggest takeaway, at least for me, was just prioritizing sleep. And that was the kind of point of the dinner too, is everyone's a founder, myself included. We're just working really hard. It's also cool to hustle, this hustle culture. People don't really prioritize their health and sleep as much, but you have to invert that almost. And if you prioritize your sleep and your health, you become a much better founder, more energy, better ideas, clearer thoughts. So that was really what he discussed. Of course, there's a couple hacks like there. He was talking about a hot sauna at a specific temperature, the hyperbolic chamber.
Don't forget about ice that you need in the sauna.
So things that like I wouldn't be doing, but like I try to go to bed a little bit sooner, turn the phone off a couple hours before bed, the lighting. So for example, here on my phone, it's white, but then I can triple tap it and it turns red. So it's a little bit better for the blue light before bed. So there's a couple hacks, but
I drop in the blue light before he goes to the late night tweeting, dude. I love it.
Yeah, exactly. Health guy dark mode. But yeah, I try my best, but it's obviously harder to implement sometimes. But very much a believer in this like longevity movement in space. And there's a lot of things that are still less talked about that I think will become more and more important as we learn more about this space too, and our bodies.
And blood tests or whatever. Have you seen sort of consumer apps that have really brought this together that have actually allowed you to change your behavior? Because most of what I've seen is like, it brings all the data together and then it's just another set of graphs and charts. And it's like, it's not actually telling me what to put in my Instacart order or what to order on DoorDash to actually make me healthier tomorrow or today.
Yeah, I think we're almost in the start of this inning where that'll be more popular and possible. Obviously, everyone's talking about agents and having it maybe be more active. Like, I think that could be this next chapter. And I think that's what Brian's trying to do with Blueprint AI is really give you these nudges and clear plan that you stick to with, of course, like an intelligent agent that has all your data and all the pathways like right there, ready to go. I frankly haven't seen that currently, but I'm maybe less of a super hardcore biohacker like yourself, to be honest. I do what I can, but I don't wear an Oura ring. I don't have an Apple Watch. A little old school from the Midwest. I feel like I know when I'm doing right and when I sleep good and stuff. But yeah, as you're talking to your physician, they're there with their open evidence tool. It's like trying to give you the counter, like something else.
The same tool for the patient. I love that.
Something like that. Yeah. It's but anyway, I'll keep my eyes open.
So Max, I think your newsletter is actually pretty optimistic, but also real. What is your big prediction for AI and healthcare, say by 2030, five years from now?
Yeah, 5 years. To be honest, I think we'll be able to unlock a lot of parts of biology. You're seeing so much money getting pulled into these drug discovery companies and just understanding the whole complex world of biology in general. I've heard a lot of mixed takes there, frankly, that we don't really need too much help discovering new targets. We really need help on the clinical trial side, really just trying to test more and see more there. But I think in general, AI has really been focused on healthcare. That's where a lot of the hype has been. But I think like bio is frankly this next frontier. Kathy Wood, who I know is controversial, has also talked about CRISPR, gene editing, and a lot of these tools like really proliferating with AI. So I think bio will be more important. In general, I think a lot of these companies will continue to grow and there'll be some consolidation in the scribe space and others per usual. I think more of this will then move into clinical decision support. Right now, it's a little bit patient averse, if you will, because of the risk levels, but I think slowly this will all move more towards clinical decision making and helping doctors and folks be a little bit cleaner and maybe more data prepared for some of these answers. That said, it's healthcare, right? So 5 years isn't that much time. There's really no clear regulation yet or robust rules. So I would love to say the AI doctor or any real autonomous type of work, but I don't think that will happen for a while, to be honest. That's my take.
No, the CDS, CDM, like the whole clinical thing, we've heard that a lot as we talk to folks. And a lot of it's like, hey, can you just help bubble up things that are in the chart, flag things for me, make me better prepared if I'm doing 8, 10, 15, 20 encounters a day, which some of these providers are. How can you surface, the yellow and red flags so that I don't miss them and at least point me in the right direction and give me like a clean, easy to visualize thing? Because like you said, if you look back a couple years, the charts are really messy in some of these EMRs, and like, it's not easy to navigate these UIs to pull that data out. And so maybe it won't be actually making decisions, but I almost think of it as clinical information. It's just, hey man, can we just normalize the resume of what's coming in? I walk in and they know who I am and they're not trying to guess.
Yeah. I want the AI doctor though, Max. Like I think if all we have is better clinical notes in 5 years, we will have failed to really realize the healthcare AI use case. Like I hope that it's better.
Yeah.
To help ease your concern there are people building in this space. Like Council Health just raised this Series A or B. I'm confused on which one it was, but they're basically building a doctor in your pocket. Doctronic as well, really focused more on primary care first, which is really like a triaging data science problem before we're talking about like specialty care. But I think tools like that will exist and do exist. So I think it'll come, but in good time, I think.
Even if you think back to what Forward tried to do or what One Medical does today, they have a lot of this data because they are in that triage thing. But I don't know. Dude, Max, this has been awesome. Like, where can people sign up for the newsletter, follow along, and quite frankly, join one of your kind of future AI or health dinners?
Yeah, so healthcareaiguy.com. We chose pretty clear SEO, just like Thai food near me. So Healthcare AI Guy, you can type it into Twitter, LinkedIn, wherever, and you'll find us.
Awesome. Max, again, thanks for being here. Such an important thing you're doing, and so cool to hear how it all got started, and just appreciate you taking some time to take us through where you see all this stuff headed. Thanks for joining us, and hopefully everyone was going to join the Healthcare AI Guy newsletter right after this.
Great chatting. Thanks for having me.
Man, Jason, that was really good. It's funny because it's something that I've been super immersed in the last several months. And
You're the Healthcare AI Guy now.
I don't know about that. I'm a journeyman for sure.
Yeah.
But it was really cool to hear how Max is approaching it, but also the breadth coverage that he's been able to put together with his newsletter. And I learned that I didn't know that he had actually learned about this doing internal news for his previous role, which totally makes a ton of sense now that I can connect the two dots.
Yeah, being inside of the biggest healthcare company and working on a team that's doing M&A, what a good window on the world of healthcare and where the money is flowing. And then before we started the conversation, he said, I'm going to PC, once an analyst, always an analyst. There's something there, right? To be able to write a newsletter and talk intelligently about a category, there's got to be some deep knowledge inside the belly of the beast. That was fun. What were your big takeaways, maybe your top 5, Kevin?
Yeah, the top of was that Max has an incredible wealth of knowledge on this topic and was citing articles about reviews and then numbers and really was sharp on it. And that thing. And then taking us into the top 5, it's like he turned this M&A news habit into the Healthcare AI Guy distribution, which then went into the Twitter account and then eventually the newsletter. And then reminding us that distribution is founder leverage. Audience first, product and company second.
I feel validated.
Yeah. And then AI in healthcare is real. Scribes, automation, burnout, relief. How do you have this faster ops? And then there's definitely pockets of hype, right? Overcrowded scribe, voice markets, some of these frothy valuations, and the inevitable consolidation or closure of some of these things. And then finally, this next wave is really going to be this patient-owned data. How do you have your bio environment focus and smarter clinical support to understand when a provider sees you, what other data they can have with?
Yeah. If this episode helped reframe how you think about health or AI, send it to somebody who needs it.
And if you haven't yet, subscribe to Founder Mode, leave us a review. It helps more people find the show. That's it for today. Because in healthcare and AI, the ones who build distribution and see around corners are the ones who win.